The North Carolina Treasurer is proposing changes to the state health plan that could possibly have a negative effect on hospitals. WNCT's Amber Joseph spoke with Vidant's CEO today and has more.
This proposal changes the way the North Carolina state health plan for teachers and state employees pays its providers. But to do that, it will reduce the reimbursements to healthcare networks like Vidant Health.
We don't understand how the Treasurer has been given the authority to make these substantial cuts to the hospitals.
North Carolina Treasurer Dale Falwell has called for the Department of Justice to investigate the pricing of every hospital in the state and is proposing cuts through Blue Cross Blue Shield to the providers, doctors, and hospitals across the state.
But here in Eastern North Carolina, it'll mean $40 million.
Vidant CEO Dr. Michael Waldron says he's fighting for what's right for our type of community.
Underserved and struggling communities, and so averages don't work because we're not Raleigh, we're not Charlotte. And so those kind of cuts get played out differently in communities that are started behind and are already struggling to make sure that they are successful.
These cuts could affect Vidant in many ways, causing them to look at how they can balance their services and funds.
We can't just absorb those cuts. We're going to have to react, so that could mean a number of things, layoffs or decreasing services, and so we're always struggling to try to make sure that we provide care to our communities and balance the money we have and the resources.
One of the largest proposed cuts on the physician side is to OBGYN services.
If you're a teacher or a person in rural Eastern North Carolina and you're having a baby, you may have to drive further, or so we're going to have to figure those things out. We've asked for information, and when we get it, we get highly redacted information, and we don't understand the rationale. And so these are complex issues, and we believe that our legislators should be involved and that there should be more oversight and input than just one person who seems to not understand the realities of Eastern North Carolina.
In Greenville, Amber Joseph, 9 on your side.